Now, more children in Kent are being supported for drug and alcohol problems than last year, with many still in their early teens. Behind the figures are families, frontline workers and people in recovery who say exposure to drugs is happening earlier, often online and often unnoticed. But what are parents and communities doing to help in the county? And Kristen Hawthorne has been speaking with a recovering addict professionals to find out more.
New data shows the number of under-8 teens being treated for drug and alcohol problems is rising sharply across Kent and Medway, with ketamine emerging as a growing concern among younger users. In Medway, the number of children and teenagers in treatment has climbed by 55%, from 110 last year to 170 this year, one of the biggest increases anywhere in England. I went to the Kenward Trust rehab to find out more.
Traditionally, probably a lot of people coming to our rehabs are sort of mid to late 20s and upwards, I would say, but I'd say definitely we're seeing a drop in the age group slightly, particularly in recent years around ketamine use. That has meant that we are having to work with a younger age group in the service.
Started taking things to look cool, do you know what I mean? So I can't remember what date it is, do you know what I mean? But I knew it was a very young age. Me using, I've lost a lot of memory from being young, so I can't really remember being young. But 15, 16, like heavy use, maybe 14.
His experience reflects a wider pattern. Professionals say ketamine use is particularly worrying because it's often perceived as low risk, yet can cause long-term damage to both physical and mental health.
We're getting quite a lot of people in now who this is their first time, and actually their addictions really caught up with them really quickly. So actually they've gone from being in what they probably thought was quite a nice space around the substances they were using to suddenly having a lot of physical pain and having a lot of suffering coming out of the blue almost for them, and suddenly having to go into hospitals, then going to detox, then going into a rehab, all within quite a short period of time compared to maybe more traditional drug and alcohol users.
Families and schools now face the challenge of the realities of youth drug use.
My son Will died 7 years ago. He died on a night out with a friend, just experimenting really. So it's just given me this passion to help educate young people about the dangers of experimenting. It's a flip of a coin at the end of the day. You haven't got a clue what substance you take is going to do to your body and how you're going to react to it. I think differently, education programme is not about not doing things, it's about informing them, giving them the information so they can make their own decisions when they're in that moment, you know, a festival, a party, they get offered something, it might make them just think differently.
Professionals say tackling the issue will require better education, early intervention and more support. But for many of those already affected, the cost of the lessons are very real. Kristen Hawthorne, KMTV.